Good afternoon, thanks for tuning in. Today I'm joined by the Chief Medical Officer and the National Clinical Director. And as you probably know, the main purpose of today's update is to indicate our final decision on the proposed changes, quite substantial proposed changes to the COVID rules that are due to take effect from Monday next week, the 26th of April. These changes include the full reopening of retail services and the partial reopening of hospitality. Before I talk in a bit more detail about those, though, let me give you today's statistics. The total number of cases reported yesterday was 178, which is 1.4% of the total number of tests, and it means that the overall number of confirmed cases now stands at 224,092. 106 people are currently in hospital, which is 2 more than yesterday, and 13 people are in intensive care. That is 1 fewer than the number reported yesterday. Unfortunately, 2 deaths were reported yesterday, and that takes the total number of deaths registered under this daily definition to 7,644. And yet again, I want to send my deepest condolences to everyone across the country who is grieving a loved one. Let me also give an update on the vaccination programme. As of 7:30 this morning, 2,750,052 people have received the first dose of vaccine. That's an increase of 2,358 since yesterday. However, in addition, 40,152 people received a second dose yesterday, and the total number of second doses administered now is 797,267. We've now given a first dose of vaccine to more than 60% of the adult population. And last week we effectively met the target of offering a first dose to all over 50-year-olds, all unpaid carers and all adults with particular underlying health conditions. Now, inevitably, there will be some people in these categories who for one reason or another may not have had their invitation letter yet. Perhaps your address has been changed or your letter has gone missing. If that's the case, remember you can phone your GP or phone the National Helpline, and you'll find the details of that on our website. But the groups that have now been offered the first dose of vaccine, which are the JCVI priority groups, they account for 99% of all COVID deaths. So the fact that a first dose has been offered to everyone in those groups and that there has been such a high take-up of the vaccine so far is a really important milestone. And that is one of the factors that is giving us the confidence to ease restrictions further. In the past 7 days, we've also seen continued welcome evidence that case numbers are continuing to fall. 7 days ago, we were reporting 287 new cases every day on average. At the moment, we're reporting 226 cases a day on average. And overall, since early January, we have seen a reduction of more than 90% in the average daily case numbers. The weekly case rate per 100,000 people has also fallen from 38 to 30 over the past 7 days. The number of people in hospital and intensive care is also on a downward trend. We have seen a very small increase in the numbers in hospital today. We will see fluctuations like that on a day-to-day basis, but at the moment the trend is firmly downwards. And thankfully, as we continue to see, the number of deaths is also falling, although every single death is still one that is causing grief to a family somewhere across the country, and we should never lose sight of that. But all in all, we have seen sustained improvement, and that has already allowed us to relax restrictions in recent weeks. Almost all children are now back at school full time, which I know will be a massive relief to them and to their parents. Over the weekend just past, new rules came into force for outdoor meetings, and of course the travel restrictions within Scotland were lifted. But taking all of the recent data into account, I am pleased to be able to confirm today that from Monday 26 April, those parts of the country that are currently in level 4, which of course includes all of the mainland of Scotland, will move down to level 3. We then expect, assuming that the data continues to go in the right direction, that all of Scotland will move to level 2 on Monday the 17th of May. And that shift will mean, for example, that from the 17th of May, people will be able to meet in small numbers in each other's homes for the first time in a long time. There'll be further reopening of hospitality, and outdoor contact sport for adults will resume. Then, if circumstances permit, I can confirm that it would be the intention to move to level 1 on Monday the 7th of June, before then I hope moving to level 0 in late June, and then as we go into the deeper part of the summer to something much more like normality over the course of July. So we are hopeful, very hopeful, of seeing sustained progress in the weeks and months ahead. But of course, I want to focus today on the changes that will take place most immediately from Monday coming. That's Monday the 26th of April. And first in doing that, I want to address some information specifically to people who have been on the shielding list because they're especially clinically vulnerable to COVID. From next Monday, the Chief Medical Officer's advice will be that people on the shielding list can return to the workplace if you can't work from home. Like everyone else, if you can work from home, then for now you should be working from home. But if you need to return to work, you should speak to your employer about how your workplace can be made safe. In addition, from next Monday, children who have been shielding can return to school. I know just how difficult the last few months have been for everyone, but I don't think there's any doubt they have been especially difficult for people who have been required to shield. So I'm very grateful to all of you for everything you have done to keep yourselves safe, but also to help keep other people safe as well. And I hope that over the next few weeks you can enjoy being able to get out and about a bit more, and that the very understandable anxiety that you have been living with for this past year is beginning to reduce even just a little bit. Now, most of the other changes I'm going to set out will, of course, apply to everyone. From next Monday, all shops which are still closed will be able to reopen, and all close contact services such as beauty parlours can reopen. Hairdressers, of course, opened a couple of weeks ago. It will be from Monday possible to collect takeaway food indoors rather than having to collect it from a hatch or a window, and hospitality venues like cafes, pubs and restaurants can reopen too. In outdoor settings, opening hours will be determined by local licensing laws. Alcohol can be served outdoors from Monday, and people will be able to meet in groups of up to 6 from up to 6 different households. The rules for hospitality indoors are different because the risks of transmission are greater indoors. Cafes, pubs and restaurants from Monday will be able to open indoors until 8 o'clock in the evening, but not yet able to serve alcohol indoors. Up to 6 people will be allowed to meet indoors. However, they must come from a maximum of 2 households. Contrary to some suggestions that you might have seen in the media, the requirements on physical distancing for hospitality in our latest guidance on this have not changed from the guidance that was in place previously. But we're also publishing today updated guidance on the collection of customer contact details. And this guidance makes clear that venues should take down contact details for all of their customers, not just for the lead member of each group. And that is an additional precaution which is really important to help with contact tracing in the event of any outbreak. And of course, it's important to remember that although indoor socialising is permitted in public places, albeit in limited numbers, cafes and restaurants, for example, it's not yet permitted in our own homes. And I know that can seem illogical. It can also seem really difficult and unfair, because it is difficult and unfair. But we know that the risks of transmission are higher, or can be higher, in the home than in a cafe or bar, because it can be harder to stick to physical distancing and to ensure good ventilation. So we hope that the rules on in-home socialising will ease from the 17th of May, but not immediately on the 26th of April. From the 26th of April, the attendance limit at funerals and weddings and related events like wakes and receptions will also increase from 20 to 50. And in addition, tourist accommodation can reopen from Monday. However, in self-catering accommodation, the rules on indoor meetings still apply, which means that until the 17th of May, 2 households can't stay in the same accommodation. Now, other changes that come into force from Monday are as follows. Non-essential informal childcare can restart. Non-essential work is again permitted inside people's homes, and that includes cleaning and also repair work and painting and decorating. Driving lessons and driving tests can resume. Gyms and swimming pools can reopen for individual exercise, and indoor attractions in public buildings such as galleries, museums and libraries are also able to reopen from Monday. Finally, but very importantly, I can confirm that all remaining travel restrictions will be lifted on 26 April for travel anywhere in Scotland and for travel between Scotland, England and Wales. So from Monday you can travel anywhere across Britain for any purpose. We will also remove restrictions on Monday on travel to and from Northern Ireland, the Channel Islands and the Isle of Man, though people should check the rules on entry to each of these territories before you travel. Now, it's important for me to stress that we might need to enforce local travel restrictions from time to time, either within Scotland or between Scotland and parts of the rest of the UK, if there are areas which have flare-ups of COVID, local outbreaks, or where the general situation is causing concern. But I hope this general easing of travel restrictions from Monday will be welcome to lots of people, and I know will be particularly welcome for people in Scotland who have family in England, or indeed vice versa. Now, there's a couple of other points I want to make just before I finish and move to questions today. The first of these relates to testing. 2 weeks ago, I indicated that we would make lateral flow tests available to anyone in Scotland who wants one. I can confirm, therefore, that lateral flow testing will be available to anyone in Scotland from the 26th of April. You can order lateral flow tests online for delivery to your home, and you can find information on how to do that on the Scottish Government's website. Alternatively, you can collect the tests from COVID testing centres in the afternoon or early evening. I would encourage everyone to take advantage of this offer, but I want to highlight one issue in particular today where we are really encouraging people to make sure they use lateral flow testing as appropriate. Last week I spoke about the situation on our islands. We are keeping island communities at the same level as the rest of the country at the moment, so that we can allow travel between island communities and the rest of Scotland. But we know that does create a risk for our island communities. Many of them currently have very, very low rates of COVID, and they will be welcoming visitors from parts of Scotland, which I know many of them are looking forward to, where COVID will still be circulating at a higher level and more widely. So if you are planning to travel to an island, we do encourage you to take 2 lateral flow tests before you depart. The second test should be on the day that you are planning to travel. The first should be 3 days before you travel. And that means if you test positive, you have a chance to take a PCR test, which is more sensitive, to confirm the result before making a final decision on cancelling your visit. But this is potentially an important way in which we can minimise the risk of bringing COVID into island communities, while nevertheless allowing our island communities the benefit of opening up again to visitors. So if you are planning on travelling to an island over the course of next week, it is possible to get tests from today, and I would encourage you to do that. Now, the final point I want to stress relates to international travel. As you may have seen in the media, because of the quite rapidly and significantly deteriorating COVID situation in India, we have changed the rules in relation to travel to and from India. There is a concern as well about a new variant of the virus that is spreading there. So from Friday, if you've been in India for essential purposes and are returning to Scotland, you must now stay in managed accommodation for 10 days, and that must be at the place where you first arrive back in the UK. So if you are travelling via London, you must stay in a hotel in London. More importantly, though, please remember that international travel for non-essential purposes is not yet permitted. I know this is really difficult for the aviation and tourism sector, but most of all, it's difficult for people who have family overseas. When we talk about international travel, there's a tendency, including on my part, to talk about holidays. But for many people, going to other countries involves seeing their family, friends and loved ones. So I understand how difficult this is and how distressing this is for a lot of people. And we do want, and I want to stress this, we want to restore normality to international travel as quickly as possible. But we must be sensible as we do that, in light of the risks that we face and in light of the risks that we see across many parts of the world. We'll continue to work with the UK government to try to agree a common approach to international travel in the weeks and months ahead. But until at least the 17th of May, and possibly for a period after that, you should not leave the UK for non-essential purposes. That is, for now, an important measure to try to protect the progress we have made domestically and continue down that track of opening up our economy and our society as much as possible. So just to conclude, the changes that will come into force on Monday, building on the changes we've had in the last couple of weeks, have been really hard-earned and long-awaited. I know that many people across the country will be looking forward, quite rightly and understandably, to perhaps having a drink in a beer garden, catching up for a coffee with a friend in a cafe, going to the shops that you've not been able to visit for some time, or perhaps taking a break somewhere in Scotland. But even as we enjoy all of these moments, and I hope people do enjoy them because you have earned them, we still need to be careful. COVID is at much lower levels than it has been in a long time in Scotland. But as you can see from the figures, it is still there. It is still circulating. Last week, more than 1,500 people in Scotland tested positive for COVID. Some of these people will require to go into hospital. Others, including many young people, will suffer from long COVID. And we must remember that the virus we are dealing with now is much more infectious than it was when bars and cafes were last open. So it's really important that as we enjoy these new restored freedoms, we continue to be really careful and take all of the required precautions. So in particular, for now, please don't meet up with other households in your or their homes. We know that that is a particular risk, but we equally hope that that will start to ease from the middle of May. Continue to work from home if you can. Download the Protect Scotland app if you still haven't done that. As you start to go out and about a bit more, that will help make sure that you are notified if you've been in contact with somebody who tests positive. And when you are out and about, remember facts. That remains the most important advice to help protect yourself and others. Wear your face covering, avoid places that are busy, clean your hands, clean surfaces that you or others are touching. 2-metre distancing remains really important, and self-isolate and get tested if you have symptoms. These measures have been important all along, but as we ease up and start to go about more of our normal business, the facts advice becomes ever more important because they become, in a sense, the first line of defence against the virus. So please continue to be sensible, take all the necessary precautions, and if we all do that, hard though it is, I am really optimistic that what we have seen in the weekend just past with some easing, the substantial easing we'll see from Monday and then into May and June, we are on a journey to something that is much, much closer to the normal life we are all desperately craving. So my thanks again to everybody for your patience and forbearance and sacrifice over the past year, and indeed for your patience throughout today's rather lengthy update, but I wanted to make sure you had all of the details of what we expect to happen in the days and weeks ahead. I will now go straight to questions. Gregor and Jason have been standing here patiently, waiting to help me with the questions, and or perhaps not patiently, knowing both of them. But we'll go firstly to Stephen Brown from STV. Can I just remind everybody, because we're still in the election, pre-election period, I will only answer questions today that are strictly related to COVID. Any other issues I will take away from here and deal with separately. Stephen Brown from STV.
Good afternoon. I just wondered a couple of quick things. You will be aware of the confusion and I think the anger amongst many in the hospitality industry in the last sort of week or so around the physical distancing measures. I know you addressed it in your opening remarks there, but just to be clear for all those cafe and restaurant owners who are watching this, would you expect that from Monday, if someone from one household meets somebody else from another household to have a meal, that both of them should sit at least a metre apart at that table? And just secondly, in terms of the testing for the island communities, you're obviously encouraging people to take the test, but it doesn't sound like it's going to be mandatory. Why did you decide not to make that a mandatory requirement before someone could travel?
Firstly, yes, I do expect people in hospitality who are from different households to stay 1 metre apart. Remember, hospitality has a separate exemption, an exemption from 2 metres, so it is 1 metre. But that's not changed from the last time hospitality was open. You refer to confusion and anger. Somebody from the Beer and Pub Association in Scotland this morning referred to it on Twitter as scaremongering. And I would, actually say that we should not have myths about the rules circulating, because it doesn't help anybody, least of all those in our hospitality sector. There is no change to the physical distancing requirements in our revised guidance for the reopening next week compared to the guidance that was in place the last time pubs and restaurants and cafes were allowed to open. And anybody who says otherwise, it is misleading people. It remains really important, though, that we do have physical distancing between people from different households, because what is also not in the interests of hospitality is if we have outbreaks again in pubs and restaurants that then lead to individual premises having to close, or outbreaks that then seed wider community transmission, and we have to have local lockdowns again, which see pubs and restaurants and cafes having to close their doors again. So this is just an essential precaution to allow hospitality to open. And the vast majority of people in the hospitality trade, I know, are really responsible about this, and I would encourage everybody to be. You are not anybody in hospitality who either tries to say that we're changing the rules or that these rules are not important is not doing any favours to the wider hospitality trade. There is one change in the rules, which is actually not a substantive change. From, when I say rules, I mean the guidance, the new guidance that's been published. From Monday, premises in hospitality will have to display their capacity limits, the overall number of people. But they're just going to have to display something that they already had to have. So all cafes, pubs, restaurants will have done their own risk assessments with taking account of physical distancing, how many people it's safe to have in, and they'll just now be asked to display that so everybody knows what the safe capacity limit is. So that's the only change in the guidance that was published, I think, on Friday last week. There's other guidance that's been published today about the taking of customer details, where we're asking now premises to take the details of all customers, not just the lead customer, because what we found in the last period when hospitality was open, that only taking that first person's contact could make it difficult to trace everybody. So these are necessary and sensible precautions, and the more people follow them, the longer, and hopefully indefinitely now, we'll be able to keep hospitality open and trading. So that is my plea to everybody in the sector. And on testing, look, we obviously don't want to make testing mandatory where we can avoid it. This is a health procedure, maybe like one of the clinicians talked here about the ethics of this. So we encourage people to get tested here, and in my experience, people want to do the right things. Lateral flow testing is becoming much more commonly used. So if you've got a child at secondary school, you'll be no doubt supporting them and doing twice weekly lateral flow testing. People in our health service are now used to doing that regularly. Teachers working in schools are becoming used to that. So lateral flow testing is something we should all get much more comfortable with and used to, because it is part of, and I stress part of, our overall approach to keeping people safe as we open up the economy and our society. But do you want to say something about testing?
Yeah, I mean, I'm quite happy to say it. I mean, this is all part of keeping it as safe as possible. By and large, I think the public have been really responsible in the way that they've responded to testing when they've been asked to do so. And this is another element of that, another facet of that, as we try to place another ring of protection, particularly around preventing the spread of infection to the islands. And I'm quite confident that people, when they choose to travel to the islands, will see the benefits, both to them, their families, and also to people that they're visiting in the islands, and making sure that they take a couple of these tests before they go, just to make sure that they don't introduce the risk of this infection into the islands. There are some ethical considerations about any test undertaking that at any point in time. So at this stage, we would certainly not want to enforce those tests on people unless we were seeing that there was a real uptick in the infections that were kind of going to the islands as a consequence of this. But yeah, this is an opportunity for people to make sure that as they travel to the islands, that they're not taking any infection with them, and to do the right thing.
Thanks. Bruce Mackenzie from ITV Border.
Thank you, First Minister. I wonder if you've any specific advice for people in the south of Scotland, because obviously with the travel restrictions being eased cross-border, there'll be some concern there with numbers of cases particularly higher in Cumbria than they are here in Dumfries and Galloway, and indeed in the Scottish border. So I just wonder if there's any particular advice about cross-border travel. And another point, perhaps for Professor Leitch, we're hearing a lot of concern from the wedding industry about how weddings can get back to normal. Now, good news that numbers can return to 50, but when do you think live music and dancing, for example, might be able to return to get weddings back to some kind of normality?
I hand over to Jason on weddings, but live music, dancing in particular. You know, my advice to people in the south of Scotland is, you know, actually the same as my advice to everybody across all parts of Scotland right now is as we open up, be really careful. And this point, I always remember thinking this coming out of the first lockdown, it almost appears counterintuitive, because as we open up, people think, well, the risk is receded, so we can sort of throw caution to the wind. The opposite is true. When we're asking people to stay at home all the time, then clearly you're not coming into contact with anybody who might have the virus. As we go out and about a bit more, okay, levels of the virus might be lower, but you're actually more likely to come into contact with somebody with it because you're seeing more people. So it becomes even more important to do all of the things that we've been asking you to do all year, whether that's face coverings or keeping a safe physical distance or wash your hands regularly. Just do all of these things. Stay away from crowded places, and maybe with the cross-border travel in particular, you know, don't go to places that are crowded, because you know they pose a higher risk than places that are not crowded. From Monday, for a period of for a period until middle of May, actually there'll be more hospitality open in Scotland than in England, because there will be some indoor opening, albeit very restricted. That's not the case yet in England. So again, if people are coming north across the border, you know, don't sort of crowd into places. You shouldn't be allowed to crowd into places indoors, but don't come specifically to sort of escape the rules in your own area. We want people to be able to travel more freely. I will be one of many people who enjoyed getting to see my parents at the weekend for the first time in months, because the travel restrictions have lifted. If you're somebody in Scotland, and there's lots of us whose parents live south of the border, you won't have had that yet. So I can understand people are really desperate for that. Enjoy all of that, but please be careful, because the virus hasn't gone away. The virus hasn't magically disappeared. We've suppressed it, and we're vaccinating to give ourselves a bit more protection. But just, if you're in any doubt about anything I'm saying here, just turn on your television or go onto the internet and look at India, look at France, look at many other parts of the world right now, Canada, where things are going in the wrong direction again. So that's what we've got to guard against.
I would just underline a couple of things then weddings a little. So the incidence in Scotland is low, but the virus is worse. Since the last time we did this, since we opened, the virus is now worse. So it is more transmissible, and it may or may not cause more severe disease. On the other side of that ledger, of course, we have vaccination, protecting the elderly and the vulnerable principally, and now protecting younger people. So don't cross the border to do things you can't do in your own country. Don't use the border as an excuse to do other stuff. That in both directions. So people from Cumbria shouldn't come to the indoor hospitality in Dumfries, and people shouldn't go the other way around to do stuff they can't do. But of course they should do it, to visit family outdoors in their gardens, because that hasn't been possible. For weddings, remember we've published last weekend, we published the indicative levels that will be in place now with the dates the First Minister has now expressed. 26th of April, 17th of May, 7th of June, and then end of June. And we've said what will be in each of those levels as far as we can at this point. It's, of course, open to change between now and then. As each of those levels comes in, we'll have to publish more detailed guidance for hospitality, for weddings, for life events, for places of worship. So we don't have each of those steps ready to go yet because we're not entirely sure where we'll be. I would anticipate dancing and music to come at slightly different stages. I would have thought music first, dancing a little bit later, dancing within households before. You get the idea. So at some point, we're going to have to remove physical distancing. We're going to have to stop that, but a little bit away from that for now. And the UK for country work is looking at how we might be able to remove some of those things in the future.
Thanks. Phil McDonald from Global.
Thank you very much, First Minister. It's very similar to what Stephen was asking, actually, on hospitality. Some of the businesses that we've spoken to have actually said that they're going to stay closed on Monday because they actually stand to lose money when they balance things like overheads and costs against the actual profit that they'll make. So I'm wondering what you would say to owners who are maybe in this position who don't want to open up because obviously they've had to reduce their capacity and they might not make any money.
Look, I'm heart sorry for any business who's been unable to trade and who continues to be unable to trade. What I would say is the rules in terms of the guidance for the opening of hospitality, as I said earlier on, they have not changed. And people who were yesterday trying to suggest they have changed are just not accurate in that. Secondly, I would love to say to hospitality, open up with no physical distance, and I would love nothing more because it would be a sign that this virus had disappeared and we were completely out of this. I would be deeply and utterly irresponsible to do that. We have already gone from 2 metres to 1 metre in hospitality. That's not risk-free, and you know, I and the clinicians standing on either side of me here right now are not without concern about that. And last year when we took that decision, it was one we agonised over. So we are going as far as we can to enable hospitality to open up with as much capacity as possible. But if we were to go further than that, you know, a business that is deciding not to open that would be able to open, there'd be a much greater chance that they'd be closed again within a matter of days or weeks, and possibly taking the whole of their area back into a difficult situation. I cannot magic this virus away. We are collectively keeping it at bay, and vaccination is helping us with that. But the idea we can just stop these simple precautions, I'm afraid, is not possible, much as we all wish it was. And I know that there are lots of businesses in the hospitality trade being very innovative about how they do open, about how they maximise capacity. I was chatting to somebody in South Queensferry just earlier on today who, you know, had opened up a new space outdoors to enable more people to come in. So there's a lot of good work there to be done. I wish we could just say go back to normal as it was before, but you know, you would not be thanking me in a few weeks' time if we did that. Physical distancing is a key defence against this virus as we start to open up our economy. I don't know whether you want to say a bit more about the importance of it, Gregor.
Yeah, I mean, what I'll do is I'll largely confine myself to the kind of science here more than anything else, Phil, but it's just to acknowledge, first of all, I've got friends who are involved in this industry just now. I know how tough it's been for them. And these decisions are not taken lightly when we provide advice to ministers as to how we should base the approach on the science that's available, because the science still suggests that actually transmissibility is a factor of how close we are to people. As Jason has already said, this is a different virus that we're dealing with compared to late summer and autumn of last year when we opened up the last time. It's much more transmissible than it ever was before. It's more transmissible because it binds to the receptors in our cells much more readily. And of course, if we're closer to people, that's more likely to happen. Those infections can occur with less of a viral load that's passed on than ever before. I have no doubt there will come a point in time through probably the vaccine use more than anything else, as we begin to see more and more evidence that it reduces the transmission of the virus to other people, that we'll be able to look at the distancing again and start to relax that further. But that point is still quite a bit in the future. Let me illustrate why that's really important just now. We've got to remember that the population that we have vaccinated just now will have some relative protection, but large parts of the population remain unprotected. If I look at the figures over the last 7 days and the number of people in the age group even 20 to 39, we had 711 people became infected in that 20 to 39 age group over the last 7 days. And that's a susceptible population. In the slightly older age group, 40 to 59, we had 459 cases. Those people remain susceptible until all of that vaccination has taken place across the adult groups. And at that point in time, we'll be able to properly assess the impact on transmission and start to look at whether we can vary some of these basic public health measures that we've taken for granted now for the last 40 months as we've tried to deal with this virus, and start to relax some of those as well.
Nicole Casells from Central.
Thank you, First Minister. I just wondered, is there any update on the Indian variant in Scotland? Are there any more cases or an indication of where they came from, and how concerned should we be about this variant?
I'll hand over to Gregor and or Jason, who'll be able to talk a bit more about the situation with a small number of cases in Scotland. The most concerning thing, though, about the Indian variant is what's happening in India right now. The situation is very, very severe in India, and it looks to me, from what I can see here, deteriorating. And I think we've all got to try to do everything we can to help India themselves deal with that. And we talk about travel from the perspective of our ability to travel freely, but we are also helping India if we don't travel there right now. So that's the key thing. Obviously, India is a large country, and therefore the seriousness of that situation can't be overstated. But it is indicative of the fact that this is a virus that is mutating. There are new variants appearing in many parts of the world. The new variant that's caused us most problem is the Kent variant that has happened in the UK. But we see variants. The Indian variant is not yet a variant of concern. It's a variant under investigation. But it underlines the fact that we can't be complacent as we get this under control here. And if we allow new variants to come in and spread within Scotland, then our progress will be put at risk. And that's why we continue to take really difficult precautions, particularly around international travel. But do you want to say a bit more?
Yeah, the situation that's unfolding in India just now is absolutely tragic to watch, and we should be very clear that there are many factors involved in why we're seeing this picture happening in India just now. The B1617 variant under investigation may be part of that picture, but as yet we just don't have the information available that tells us exactly how significant this particular variant is in terms of driving the number of cases that we're seeing there. India will be collating data in relation to this just now. They'll be looking at how transmissible it is. They'll be looking to see whether it's associated with more severe disease. And they'll also be looking to see whether it has any features which allow it to either escape the immune response that people have already developed, or impact on the treatments that we know will work against it as well. All of that will be getting looked at just now, will be shared internationally once that's available. But the essence is just now, at this point in time, we still lack full information about the significance of this variant. That's one of the reasons why it's still a variant under investigation. It's not been classified as a variant of concern by the WHO at this stage in time, while we're kind of collating that information. The variants which we're particularly concerned about just now, which we're tracking across the globe, are the B117 variant, which we've already had experience of in this country, the B1351, which has been associated with South Africa, and we see has spread globally in many countries, including continental Europe, and the P1 variant, which first was identified and it's thought to have arisen in Brazil, where we see some really, again, some tragic and devastating stories unfolding in some of the countries, particularly in the southern part of South America just now as well. These are the variants which I'm particularly tracking closely to make sure. In answer to your question, we've not had any additional cases of the variant which have been identified beyond the 4 which we've already looked at. We'll continue to make sure that anyone who's testing positive, who's come back from India, is then have their samples subject to further sequencing and analysis. But the capacity that we've got now, looking at genomic sequencing across the country, means essentially that all of our positive cases that are going through the Lighthouse labs are now being sent for further sequencing, and we're working on developing that same capacity for the other tests that are going through our NHS lab. So we're in a very good position to be able to monitor for this and make sure that we're tracking this and make sure that as these cases, if they arise, we're able to then respond to them.
Thanks. Tom Eden from PA.
Afternoon. Hello. Can you hear me?
Yep.
Oh, sorry, good afternoon. Next week's easing of lockdown restrictions is probably the most wide-ranging and comprehensive since at least last year. And as obvious as it sounds, we're going to come into contact with a lot more people than when we were all locked down indoors. So I was just wondering, how prepared is our track and trace system to deal with that increase? Will the system be effective, and are there enough contact tracers in place? And just following on from that, if there is a rise in infections, hospitalisations and all the measures that you measure this with, is there a trigger point in which we could be put back into lockdown, or is the current suppression and vaccine rollout enough for you to be confident that we've seen the last of lockdown?
I certainly hope we've seen the last of lockdown. I would be, I think I would be wrong to stand here and say I can give 100% guarantee of that. I fervently hope, and we will be doing everything in our power, but we can't do it alone. We need everybody to work with us to make sure that we don't go back into lockdown. As you know from past experience, this lockdown, no lockdown is not necessarily a binary thing. So as we ease up, we undoubtedly will have outbreaks, we'll have flare-ups in particular areas, and we will use the same, very proportionate, tailored approach to try to deal with those while keeping the vast majority of people able to enjoy the easing up of restrictions in the way that we had planned. But as people come together, the virus has more opportunities to spread. So the way we keep it under control is to follow all the mitigations that are in place and continue to be as careful as we've been all year. In fact, if anything, be more careful for the reasons that I've already set out. But I very much hope this will be, and the reason we are being cautious about this is so that we can try as hard as possible to keep this all moving in the forward direction and not have to take steps back. But there are things that we need to bear in mind every day. Jason's already alluded to one of them. This variant of the virus that now accounts for most of our cases is more infectious than the virus that we were dealing with when we came out of lockdown before. So we need to bear that in mind. And although we've done incredibly well and are doing incredibly well around vaccination, there's still a lot of people in our population who are not vaccinated. So this is not a moment to throw caution to the wind. The last point I would make, Jason may want to say a bit more, is that I was asked a question earlier on about hospitality being really frustrated at physical distancing, and I understand that, but I speak to people, just now, some of whom are really desperate to do things like get back into a beer garden and have a drink, others who are really nervous about it. And I think for pubs, cafes, for premises in the economy more widely, the more customers can see that there are proper, safe, careful precautions in place, I think the more confident people will be to go about their normal business and go back to these places. So we've all got a part to play here in getting back to normality, but doing that safely and in a way that doesn't allow things to spiral out of control again, that inevitably would take us backwards, which is not what any of us want to see.
Our advice has been pretty consistent to the First Minister that we hope for a forward gear, but we always have to have a reverse gear. There isn't a specific trigger for going backwards, but if we see outbreaks around places like we did before, around towns or workplaces, of course our advice will be to manage that outbreak. Test and Protect is ready for that. It's mature, it's staffed, and now, because of the lower numbers, it can concentrate more on that enhanced contact tracing around variants, enhanced testing and protecting around workplaces if there are outbreaks, or in hospitality or in a place of worship, whatever that might be. There are 3 weapons against this virus, every variant. It's never changed. Human behaviour, vaccination and test and protect. And each of us have a responsibility in them. The government clearly has a role in all three of them, but equally us as individuals, citizens. We have a role in the human behaviour bit, the test and protect by going for the test, downloading the app, and attending for vaccination. So it's up to all of us to keep that forward momentum.
Sorry, Jason covered it. I forgot to say, yes, I am confident in Test and Protect. Test and Protect has not stopped working right throughout lockdown. The reason we can stand here and report number of cases every day is evidence that Test and Protect is continuing to work. Cases are being identified, they go into the system, they're contact traced, and actually, even as the levels of the virus fall, we should take a bit of comfort that we are still reporting some cases, because that is evidence that the system is picking them up and doing what is required. But Test and Protect is doing a fantastic job, and we will continue to do everything we can to support it, everything we need to support it in the period ahead. Conor Matchett from the Scotsman.
Thank you, First Minister. A question on care homes, if I may. There's a revised version of the hospital discharges into care homes report coming tomorrow, according to Public Health Scotland. Wondering, A, if you've seen it, and B, if it says anything new or different compared to what we were briefed on back in October. On a similar note, the BBC published the closest thing we have to a full indication of the extent of care home deaths in Scotland. I'm wondering if you have any thoughts on that. And thirdly, just a question for either Professor Leitch or Dr. Smith. I'm just curious to know why, given we are at higher case levels than we were when we last came out of lockdown, and also than we were when we went into stricter restrictions in September, why we're not just waiting until everyone's had a first dose of vaccination before beginning this step-by-step relaxation of COVID-19 measures. Thank you.
On the first question, I certainly haven't read it, but even if I had, if it's published tomorrow under the rules that govern publication, I wouldn't be able to tell you today what was in it, but we will see that tomorrow, and I'm sure if you've got questions on the Public Health Scotland report tomorrow, we will respond to them. More widely on care homes, I've spoken a lot about the situation in care homes. Sometimes what I say is reported in the way that I meant it. Other times it is perhaps not deliberately, but mischaracterised. We, at all stages of this pandemic, have taken the decisions we thought were best to keep people, including people in care homes, as safe as possible. But we have had a developing knowledge about this virus. We know things now about the dangers of asymptomatic transmission that we didn't know then. And if we had all of the knowledge, if we could turn the clock back and have all of the knowledge then that we have now, undoubtedly there are things, not just around care homes, but particularly around care homes, but perhaps more widely, we would do differently. But we didn't have then the benefit of the hindsight we have today. Too many people in Scotland have died overall, and too many in care homes. The numbers of people dying in care homes in the second wave much lower than in the first wave, although that's no comfort to anybody who has lost a loved one. But the reason they've been much lower is that we have learned lessons as we've gone, as our knowledge of the virus has developed, and applied that knowledge and made sure that we were doing everything that was required. But, you know, every single life lost in this pandemic, particularly I think the lives of older, more vulnerable people in care homes weighs heavily on all of us. And that's why I think a public inquiry, not just looking at care homes, but certainly looking at care homes and every aspect of our handling of this pandemic is so important. And I want to see that get underway before the end of this year. And if I am in a decision-making position, I'll take the steps to make sure that that can happen. Before I hand over to either Gregor or Jason, this is not directed at you, Conor, just it's a more general comment. I suspect we are moving into that phase where the questions cease to become, why are you not opening up more quickly? And become, why are you opening up as quickly as you are? We went through that phase last year, and I'm pretty sure we're about to go through it all over again. We're opening up at the pace we think is right. This is not an exact science. It involves a lot of difficult judgment. Some judgments I like to think most judgments we get overall right, but some judgments we might not at some moments. But we're trying to do it at a pace we think is sustainable, so that we open up gradually. in a way that allows people to get back to some kind of normality, but still keep this virus under control. And that's what we are seeking to do. But which one of you wants to?
I'll start, maybe
Okay,
kind of fill in the bits. But I mean, essentially, the case rate is only one of the measurements that we look at, one of the pieces of data that we look at that helps to inform the advice that we give to ministers about how we should approach this, because the case rate that we're dealing with even now, those cases that we reported, this last 7-day cumulative instance for Scotland, 29 cases per 100,000 is the very latest data that I've got just now. Even that isn't the same as the case rate that we might have reported in autumn last year, because our testing strategy is very much different. And we're case finding in a much more aggressive way than we ever did in the past because of the volume of asymptomatic testing that we're now able to do. So we're actually able to remove much more infectious people from circulation with the ability to pass on that infection than we ever were able to do before. So those two measurements are not directly comparable, is the first thing. Is one of a number of measurements that we use, as I say, to try to guide that advice. But we've also got to remember that actually even with a case rate of 29 cases per 100,000, even if everything else was equal, it still wouldn't be the same, because we've got this wonderful vaccination programme just now which has offered protection, particularly to those who are most vulnerable to severe disease just now. So I would expect, although there may still be some people who go on to develop severe disease, we'll continue to make sure that we do all that we can to reduce that to the absolute lowest level. The volume of people who were vulnerable within our communities has completely changed compared to before as well. So that influences the advice that we're able to give just now. And that's why, as I say, we review a number of different pieces of data from a number of different sources, looking at hospitalisation, looking at deaths, looking at the case rate and positivity, a number of different other things as well in terms of contacts and so forth, and balance that against the other harms that are happening to society. And then we can give advice for ministers and able to inform their decision making.
Thanks. Did you want to add? Jason?
No, I think that's covered.
Okay. Regina, he is from the Telegraph.
Good afternoon. Latest data has shown that daily COVID deaths in the UK have now dropped below those from road accidents. And given your data over dates approach and the impact on mental health and the economy, do you think it would be possible to bring some of the planned easings for May 17th forward, given now there's apparently a greater risk of crossing the road than dying from COVID? And just on that note, the nighttime industry is warning that up to 24,000 jobs in Scotland are at risk within weeks, as they still haven't been given a target date for venues like nightclubs to reopen. So can you provide any reassurances to the industry and give a target date of when the nighttime economy can resume, as you've done with other industries? Thank you.
I think, if I can put this gently, you have to be really, really careful comparing numbers dying from an infectious virus and numbers dying in road accidents, because the causes of these deaths, all of them are tragic, and all of them leave people, heartbroken and grieving. But the causes of them are very different. Road deaths are not contagious; they're not infectious in the way that COVID is, and therefore, if we ease restrictions, then we potentially have growth that will very quickly lead to the number of people dying increasing. So I think while it perhaps makes for simplistic headlines, these things, I think you just have to take a lot of care around the comparisons. We will, as we demonstrated last week, we will accelerate if and when we can. I would, I suppose, urge a bit of caution around an expectation of acceleration of the 17th of May reopenings. Why? Because what we're going to open up on Monday is substantial. We are going to see large parts of the economy open up. We've, over the last couple of weeks, had big changes, children go back to secondary school, for example. So I think that 3-week period will be really important given the scale of the changes that we will see on Monday. And in terms of those parts of the economy that have not yet got indicative dates, we will work to do that as quickly as possible.
I was only going to say your comparison simply doesn't work. Unless you're going to allow people to drive cars with no seatbelts and bald tyres, road accidents are stable. We could have exponential growth in weeks if we get this wrong, and people don't follow the guidance. That's a key difference. The comparison with the present death rate between these two completely distinct causes simply doesn't work.
Dan Vavers from The Sun.
Thank you, First Minister. On international travel, people in England now have some idea of how it might work when they get to that point. Given you said you want a four nations approach, does that mean we might see a traffic light system like the one Boris Johnson has described here in Scotland? And when do you hope to let us know? Secondly, on vaccinations, are we likely to hit the 400,000 a week number that you said you expected a month ago and was named as a target in the vaccine deployment plan? Because levels have been fewer than 250,000 a week over the past fortnight. Thanks.
We'll set out our position on international travel when we reach that position. I'm not convinced it's as clear-cut in England as you say. I don't think the decisions have been made around the 17th of May, but we'll try to come to a common position, but we will take the decisions we think are right and set them out as soon as possible. On the second point, as we've always said, and just to remind you of the kind of obvious point here, that we can only vaccinate at the speed of the supplies that we have. We've had some fluctuation in supplies. We're having to shift, you'll see that in today's figures, more firmly into second doses for this period. But the key target that we set was to complete the offer of the first dose to the JCVI 1 to 9 priority groups by mid-April, and we met that target. We are now working towards the end of July target of vaccinating or offering the vaccine, first dose of the vaccine to everybody in the adult population. But you can't get to 400,000 a week if you don't have the supplies to get there. But we are meeting the targets that we have set for the vaccination programme. Helen Puttock from The Times.
Very much. I wondered if I could also ask a little bit about the Indian variant. The last update said there were 4 cases in Scotland. Can you confirm that's still the correct figure? And do we know if those cases were the result of non-essential travel? And is that resulting in any kind of police investigation? And finally, can you tell us about the measures you're taking to protect Scotland in the event of a rush of people returning from India before Friday? Thank you.
In terms of, there are already arrangements in place for travel, so people coming back have to isolate at home. This changes that it will be managed isolation. So there are precautions in place already, so it will not be a rush with no precautions in place at all, if indeed there is a rush, to use your word, at all. I'll hand over to Gregor on the Indian variant, but these are small numbers. Because they're small numbers, there will be a limit to how much identifying information that can be given, because for obvious reasons, but they're being managed appropriately, and that's the key point right now, that these variants from international travel are being managed appropriately in Scotland, and that's important. But Gregor.
So I think all I would want to say in this, Helen, is that you're absolutely correct. As of yesterday, there are still 4 cases of the B1617 that have been associated with India, which have been discovered in Scotland. 3 of those were associated with travel, plus 1 contact of those 3 people. There have been no further identifications of any other variant associated with 1617. And in fact, the team who looks after our genomic sequencing has had a good look back and through all the previous data, and they've seen no evidence of any previous identification of a similar lineage to this as well. So the situation remains at 4. I expect that will increase in time. I think that is very possible. We've had another 12 cases associated with travel to India in the last 7 days. It may be that subsequently some of those are identified as being that variant. We just don't know yet, but we'll continue to monitor all cases.
Thanks. Helen McArdle from the Herald.
Hi, afternoon. I just wanted to ask on hospitality. It was just to clarify. So my understanding is that when we move into level 3 next week, you'd be allowed a maximum of 6 people from 2 households, but all you would be looking for is that the 2 households are 1 metre apart. So you could have 3 people at one end of the table and 3 at the other. But correct me if I'm misunderstanding that. And just on the point with the households, I wondered last time when we were open, when you're allowed a certain number of households to meet up indoors in hospitality. To what extent, if any, were there issues with people, breaching the household limit, not necessarily the number of people limit, but the household limit? And what do you expect hospitality businesses to do to potentially enforce that, so that we don't have 6 people from 6 different households meeting up next week and pretending they're from 2 households?
So just to be clear, indoors it is 6 people from 2 households, limited indoor opening next week, and that is the limit, 6 people from a maximum of 2 households. And yes, you're right, the 2 households, so if it's 3 and 3, would have to be 1 metre apart, but the 3 people in the same household don't have to be 1 metre apart because they're the same household. They don't stay 1 metre apart when they're in their own homes. Outdoors, it is the same as the limit that we brought into force last weekend for people's gardens, which will be 6 from 6. So that will apply in hospitality too, and we will need 1 metre distancing. Now, not everybody will choose to go into hospitality in groups of 6 from 6 households. Many, I'm sure it will still be, 3 and 3 or 4 and 2. But that's the distinction between indoors and outdoors. Anecdotally, when hospitality was open before, I certainly did hear that people were, claiming to be in the same household when they weren't. Look, there is a lot that we can do to mandate rules and put in place enforceability around rules, but fundamentally, and actually this has stood us in really good stead because the vast majority of people have complied. This comes down to all of us doing the right thing because we know how important it is to do the right thing. So it has to be incumbent on hospitality to do everything they can to make sure their customers are abiding by the rules in place. But fundamentally, for every single one of us as an individual, we've got a responsibility to make sure we're abiding by the rules for our own safety and for the safety of people around us. If you break the rules and put yourself at risk, if you were only putting yourself at risk, that would be one thing. But with an infectious virus, you're not. By putting yourself at risk, you're potentially putting everybody you come into contact with at risk. So we have to really say to people, and as I say, I am full of gratitude and admiration for the way people have been doing this. It starts with all of us being the responsible citizens that we know we've got to be in the circumstances we're living through. Rachel Watson from the Daily Mail.
Thank you, First Minister. I just want to follow on from that in the 1 metre distancing and 2 metre distancing social distance measures, really. You've spoken a bit about those today, and you've also said that there are things that you would like to ease further on in the summer. Is social distancing something that any of you think could go away later in the summer, or what would it take to be able to kind of either make those distances smaller that we have to stay away from others, or for those to go away completely? Is that realistic that might happen by the end of the summer, really?
I know, and I understand and appreciate that's a question everybody would like a really definitive answer to right now, but I think I'll ask Gregor and Jason if they can be any more definitive, but I think to be definitive about that right now would be entirely speculative. I think we'd all love to see physical distancing able to be eased or taken away altogether. But I think at the moment it is one of the things that by sticking to it, we enable normality to be restored in some respects. So because we are asking people to continue to stay a distance apart, we can open shops and we can open hairdressers is a bad example because of the nature of what it is, we can open hospitality. In terms of looking ahead and being able to move away from that, I guess one of the things would be greater understanding of the impact on transmission of the virus, of the vaccine. So I wouldn't rule it out for later in the year, but equally I would be very cautious about giving anybody any firm steer that said, come the summer, physical distancing will no longer be required at all in any circumstances.
So Jason spoke earlier about the 3 tools that we have in the box that can help us to contain the virus just now. And those behavioural measures are equally as important as the vaccination programme and as the test and protect programmes at this point in time. And as the vaccination programme proceeds and as we learn more about transmission, it may be that we can start to tailor some of the other approaches a little bit more as well. But at this moment in time and for the foreseeable future just now, we're still going to need some of those behavioural protections that we all take for granted every day for some time yet, I suspect. And to speculate as to when we'll be able to start to change some of those just now, I think is probably unhelpful because I think there is much that we've still to learn about the impact, particularly of the vaccination programme on transmission yet. And once we're much clearer about that, once we've started to vaccinate more and more of the adults across the country, the adult population. And once they've had their second vaccine, we'll have a much clearer sense as to what extent we can start to calibrate the rest of those protective measures to make sure that people get back to as much normality as possible. What time that will take, as I say, I think would just be complete speculation just now.
There are some international examples of baby steps in this direction now. Israel is beginning to think about physical distancing requirements, but hasn't done it, so you still have to distance in restaurants. New Zealand, you can count the cases in New Zealand on one hand almost now, and they have big stadia full of people. So it's about the level of the virus and your risk of future virus, remember. So the reason New Zealand can do that is they're very confident in their border controls. Now, as they open up, which they've done to Australia this week, so Australia and New Zealand now have a travel corridor, that may cause their numbers to rise and they will go backwards. They'll have physical distancing again. It's a key intervention and none of us can predict when that's going to be removed. I look forward to that day, but it's not going to be in the next few weeks.
This all remains a trade-off, and the more you do of one thing, the more important it becomes to not do something else or to have mitigations around it, and that is just where we continue to be. But let's hope in the not too distant future we may be in a different place. Last question today, Paula Murray from The Express.
Hi, good afternoon and thank you. Most of my questions have been answered, to be honest, but going back to the island communities and testing, you said that it's to protect the island communities to ask people to do 2 tests ahead of travel. Does that apply the other way around as well? So somebody from island community comes and visits Central Belt somewhere and then wants to go back. Is it recommended that they also do the test? And secondly, could that be an avenue to go back into large-scale events eventually, to begin with?
Sorry, I missed the last part of that question there. You broke up.
Could testing be, could testing be also used to allow large-scale events to return to begin with?
I mean, testing may well, in response to that last part of the question, the testing may well be part of an approach to opening up larger scale events in the future. It's like there's very few things in the handling of this that it's all one thing or another. There's very few magic wand solutions, but testing has a part to play in many of the solutions that we're trying to devise and implement. On the first part of your question, so the testing for islands doesn't apply for people coming from the islands to the mainland, because this is about people who are going from higher prevalence to lower prevalence, not the reverse. But, you know, yes, if you have travelled from the islands to the mainland and are, you know, staying for a period, then it may make sense to do the lateral flow testing before you go back, just to make sure that you're not taking the virus back with you. Now, obviously, the practicalities of doing that, you know, 3 days apart will depend on how long you're on the mainland. But if you've been here, you've been in contact with other people, then it would be a sensible precaution to do that, to make sure you're, if you were to have the virus, you're not inadvertently taking that back. Any final points?
You're right.
Okay, that concludes the questions for today. So thanks, as always, to the journalists and to Gregor and Jason, to Yvonne for the interpretation today, and to all of you for tuning in. Monday's a big day, a good big day, a big step back to life, something like as we once knew it. I know there'll be lots everybody is keen to do. I'm no different to everybody else in that respect, but please, as you do it, be careful, follow all of these precautions. They become more important, not less important, as we open up, and if we all continue to do that, then I'm optimistic that come the middle of May we'll be taking the next big step back to normality. Don't forget the lateral flow testing also becomes available from the start of next week, so you can go onto the Scottish Government website and find out how to order tests to your home or collect them from testing centres. And again, another important way of making sure that we're all acting in a way that helps keep us collectively as safe as possible. There are no further scheduled briefings between now and the election. However, if there are unforeseen circumstances, we will let you know about that and conduct briefings as necessary. But in the meantime, thanks again for everything you're doing, and stay safe. Thanks very much.